I'll ring the bell. Okay, welcome to the North Texas Rotary E-Club, August 9th. I have to check the day. I never know what day it is. August 9th. And thanks everyone for coming. And I'm trying to think.
Are you recording?
Yes, I set it up. It's on record.
Okay.
And I record every week. So Linda will do the affirmation, and then David will do the pledge.
As we gather here today as members of Rotary, we pray that we are ever mindful of opportunities to render our service to fellow citizens and to our community, keeping in mind always the enduring values of life, exerting our efforts to those areas and on those things upon which future generations can build with confidence. Let us continue to strive to make a better world. Amen.
Oh, look at you. You're all ready now.
Yeah.
Okay. Okay.
Yeah.
I pledge
Allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay. I'm trying to think if there's any is there any new business that we need to discuss?
We got a new member as of today.
Okay.
Tiffany Mason, who was at our installation.
Okay.
And so she'll be with us on next week. I have ordered 5 new packets to send to members. That from last time that they didn't get them through the mail or whatever, they didn't get them. And we needed more. So I've ordered those today. One of the things, Howard's going to be in town next week.
Yeah.
And I was wondering who on Tuesday or Wednesday might be able to join us for a dinner. Jack, have you found out yet?
Oh yeah, I'll let you know at the end of the meeting.
Okay. It's the first time in 2 years. Unfortunately, my wife's got a girlfriend. She's very, very sick, and we don't expect her to recover. So Vicky wanted to come and visit, and I wanted to go to see everybody anyway. So it's kind of a mixed, happy and not so happy trip.
So Jerica, did you say you were interested?
Yes, I cannot do Tuesday because I have a governor visit.
I'm free to Tuesday night or Wednesday night, so whichever one you guys pick is fine. I'm open both nights.
Okay, and then Silas can come down too?
Yes, I'll bring it.
Well, he be in school yet?
No, he starts on Thursday morning.
Okay.
Yeah, so he'll be fine.
Okay, Jack, can you check on Wednesday night for us, please?
Wednesday night?
Yes.
Okay.
I'll check with Chris.
They're taking me to Ruth Chris.
We're going to McDonald's. Are you buying, Howard, since you're wanting to see us?
Oh no, I'm president. The president doesn't pay. If I'm paying, we're going to McDonald's. Okay.
We'll try to find someplace in Dallas.
That's fine.
I looked at that place that Tushar said, but they're not open at night.
No,
So,
Addison's a good place to look. There's lots of restaurants there.
There's an Olive Garden, or there's all sorts of places along there, and we'll figure out where.
All right, there's 100 restaurants. I think there's a Chewy's there, if I'm not mistaken. Yes, there was on Beltline. There was a Chewy's.
Okay.
That's always nice. That's always a nice place.
I know, that's where we go in Orlando with you.
Yeah, I'm just saying it's a nice place. Trying to think, any place you want to pick is fine. I don't really care.
Okay. And then I guess
No sushi.
Oh, there's Deborah. Deborah, we have an exchange student. We're coming to meet at 11 o'clock tomorrow night if you're interested in going to the airport.
At 11 o'clock.
At 11 o'clock at night. So, anyway, but Jack will be there, David and I'll be there, Jericho will be there, and so he's coming in from Switzerland.
Very nice.
Where's his connecting flight coming in from, that he's coming in on American?
Jericho better be.
He comes in to Philadelphia.
Oh, through Philadelphia and then down. Okay,
Yep,
we'll
yep.
go to Customs in Philadelphia.
Yes. So I kind of talked through him with that process this week. And then I also did get clearance from Mike that he can go with us on the convention cruise or the conference cruise in April. So we're going to take him. So thank you on behalf of Rotary E Club for sponsoring $500 for him to be able to go and join that venture with us. So thank you.
That's very
And
nice.
the Foxborough Rotary Club is giving him so much a month while he's here.
Yes, the Texoma Rotary Club is giving him $100 a month as a monthly stipend.
Very nice. Oh, I want to remind if anyone hasn't paid their dues, if you've paid it, great. But if you haven't, you really need to at least. I think Linda said at least 100. So we have to pay the district and Rotary International. The rest is we would like to get it now, but if you have to, split it into more than one payment, that would be okay. But she needs to get at least what she has to pay Rotary International and the district now, and then the rest you could pay out over the rest of the year. But if anyone hasn't paid it, we'd appreciate it if you would get that done.
And some people are just doing it through Zelle to me, and then I write a check into our checking account.
Right.
And so, and we just changed checking account, so we've got everything set up with Bombora again, our credit card company, and so we do have money in the bank. And so anyway, but I guess it's about time now. If do you want me to introduce the speaker, Howard?
Yeah. Why don't you do that? Yeah.
Okay, we're pleased to have Charlie Wasser with us again. He's been a Rotarian for a number of years. I knew him through Pets. He's a vendor and had his Rotary items. And now he's working with RotaCare, setting up, it's like a free clinic. And he started it in California, and now he's bringing it to San Antonio. And then we all know Sonny Sharma from Houston, and he's also on the board of RotaCare. So Charlie, thank you again. We appreciate you, and you're on.
Thank you. Yes, Linda and I have known each other for just a little while, maybe 10, 12 years. And we kept running into each other at pets. And like she was saying at the time, I was a Rotary vendor, and I figured it was time to retire. I was going to do one more year. The pandemic helped my decision because they wanted the vendors to be virtual as opposed to going to pets. So I just kind of backed away from it. I was living in California up until a little over 2 years ago. And California expenses are incredible. House that I bought was worth about $300,000 in 1988. It is now over $2 million. I have absolutely no idea why people would pay that kind of money, but to live in California, San Jose, you pay that kind of money. So I figured, okay, here we are getting ready to retire. The house out here was $250,000 on a quarter of an acre, much bigger house. I said, that's not a hard decision. So anyway, when I came out, I decided to take the concept of RotaCare with me. RotaCare was started in the San Jose area in 1989 by a district governor. His name was John Fisher. All of us hold John in reverence. He was a great guy. He passed away about a year and a half ago, and he was still on board at RotaCare. He was in his mid-90s, and to show you how dedicated he was. Basically, RotaCare is a free clinic, and I will, screen share at this point. And just a second, please. All right, now has that come up for everybody? Can you see the screen, my slides?
Yes.
Okay, great, thank you. Okay, now, RotaCare again was a group that started in California. We had some clinics around the country. But what was happening, especially when I moved to San Antonio, it was more of an overhead and it was slowing things down with bureaucracy, so some of us kind of broke off. I don't know if we had done that the last time I spoke here, but now what we're calling the group is RotaCare Free Clinics, Texas, Oklahoma. The reason for that is we're going to be opening clinics in Texas and in Oklahoma eventually. The first 4 will be in San Antonio, and I'll get to them in a second just to give you an example of what's going on. Some of you that have seen this presentation may remember it. Towards the end is where you'll see some changes and how we're ready to, I think, explode with this, and maybe, you guys have more to think about if you want to come around to it. Hang on a second. Okay, the mission of RotaCare: to develop, support, and enhance the delivery of free medical care for the relief of pain and suffering to those people in the most need and who have the least access to medical care, by establishing and supporting free clinics to provide such medical care. In other words, what I'm looking at right now is coming up with what we would call a regional board or regional area of Texas and Oklahoma, and help people around, Rotarians mostly, around these two states start these clinics, so that you would be choosing the underserved areas that you would want to work with. And a quote from a doctor who's probably been around since day one, Dr. Tam Nguyen, said, "Some of these patients have received almost no care before, so you can see a dramatic change in them." Now, one of the examples that I give people, there's a clinic in a church in downtown San Antonio in the homeless areas, and they work on Sunday mornings. It's a church, and they work on Sunday mornings with their patients, about 4 or 5 hours. It is outside our network, but nonetheless, these people line up or they sleep on the sidewalk to be ready for the Sunday morning clinics. One of the things that they handle is dermatology. I was walking around on a tour, and the doctor that was doing the dermatology showed me what he was doing, and this poor gentleman who needed the help had something like about a 6 to 8 inch scar, and there was no way that a fellow living on the street was going to get that taken care of. So here he was, he probably had all pain from it, and the fact that it was a scar, if he did anything to it, it was open, dirt would get in. So the doctor was taking care of it for him. And that to me is just, a mind-boggling experience that there's a way of doing this to deliver this kind of care. This shows where clinics are or have been. This is the 10 in the California area. This one was one I helped open in Maryland. This one is in New York. They're sort of outside the network. And this one is El Paso. El Paso is still tied into them, but quite honestly, once we are up and running, which I think we are at this point, I'm going to invite them to join the Texas organization. You'll see what the advantage is to being in a larger organization in a second. So what, the medical services that we offer people would be things like basic, like cuts, just general pain, and when you can't afford a doctor, you have pain, you live with it. You hope the aspirin that you've been able to get somewhere is going to work. Diabetes, diarrhea, fever, dermatology problems like I explained. The pharmaceuticals, this again would be something that we may be able to help statewide. I'm still looking into that, but it can be set up in such a way that a clinic will give a patient the prescription. The person will take the prescription to a particular drugstore with which we have an arrangement. To the patient, the drugs will be for free. The drugstore will then bill us in turn. And if you do our job at a discounted rate, the discounted rate again, just because it'll be their contribution, and also as the network grows in Texas and Oklahoma, hopefully we get a bigger discount for the group purchasing power. The last one, the preventive exams, also includes diabetes. That's the kind of thing where somebody comes in and says, "Oh, my hand hurts." While we've got them there, we would also give them free scanning for diabetes, for blood pressure, and whatever. Diabetes and blood pressure both are things that until issues really get pretty bad for you, you don't know you have a problem. You don't understand there's a problem. Going through that and hopefully trust being built in these people, we would explain, or the doctors would explain, that they have these problems, and we will help them either solve the problem in that clinic or recommend them on to another hospital, or to a hospital that will handle it. And hospitals do look to us to offload their emergency clinic, their emergency wards, because people that come into emergency wards, the hospital has to see them whether they can pay for it or not. And in our case, it would be cheaper for the hospital. The hospital helps us financially with that. The next area, I've got like the dream, hopefully we can get this going, because it'll be a personal pain if I don't get this up and running soon. But anyway, one of the things we're gonna do is once the clinic is up and stable, we're gonna look at what is now known as social determinants of health. And the example of that is a person's not going to be healthy if they don't have enough food, if they don't have housing. They can't work if they don't have childcare, or if the parents get sick, the child has to be somewhere. Mental health environment. When they're living in stress, the mental health goes frequently. The physical environment, is it in a slum? Are there vermin, or is there any kind of filth on the street? Again, the unfortunate homeless people, we try to help them on that. Medical care things, the obvious what we're doing, health education, and we also have made some contact with WHO to assist them with their cervical cancer eradication program. WHO is an organization that when Rotary was first deciding to go after polio, WHO was telling Rotarians that it was impossible to eradicate a disease, and what does a service organization know about eradicating this disease? We are indeed almost that close to eradicating disease. So I guess who got on the bus trying to eradicate diseases, and cervical cancer is one of them, and that would include scanning and things like that. So all that will become part of the clinics as we grow. Now, when I say health education, part of what I'm looking at when I find a facility, and 2 facilities that I'm looking at right now to open in, they have enough room for us to have seminars, and the seminars would be on things like proper diet, proper cooking, child rearing if necessary, things like if you have diabetes, how do you eat it? How do you live with it? How do you maintain your health? If you've got high blood pressure, what do you do with your diet? So that these would be extra seminars, so that the people would get comfortable and get used to coming to, in one case, a church, another one, a tech school campus. And feel free to jump in and interrupt if I go too fast or you want to explain something. So now the next step in all this is, how is this going to work? Everything in life needs partners. The Health Education and Wellness Rotary Action Group has accepted RotaCare as a partner. We haven't really worked out, since we've got a couple of different RotaCares around the country now, how that's going to work out. But they were making a point of inviting me to the convention in Houston to stand in their booth to talk about RotaCare. If you don't know what a Rotary Action Group is, it's a worldwide organization, worldwide group that is specializing in something. In their case, health education and wellness. There's a Rotary Action Group for other types of illnesses. There are Rotary Friendship Group, fellowship groups for things like cyclists or photographers. Linda could probably expound on that, to give a better list of what's available. But that is something that's a good sign. We are formally outside of Rotary, even though most of us are Rotarians, the people working on this, so that we're able to join and kind of advertise in the Rotary environment. National Association of Free and Charitable Clinics, that's a nationwide trade group, shall we call it, and they have the buying power nationwide, so that we would be able to tap into any of their sources for things like insurance, pharmaceuticals, and on and on. Texas Association of Charitable Clinics, that's similar to the National Association, but they specialize working with charitable clinics in Texas. Now, my plan is for the organization we're building to buy one membership, which would be $250, unless we grow big enough and it'll go up to like $400 or $500. They in turn have a lot of educational seminars, but they also acquire grants, and they divvy up the money between the clinics that are members. The El Paso clinic was offered $2,000 by them. And it came with the terms of, okay, in the next 6 months, you have to use the $2,000 on pharmaceuticals. To me, that's a gift from somewhere. And it's like, here's $2,000, just promise to buy pharmaceuticals. But it's like, okay, I can do that. The other one, the big area too, is since we are all Rotarians, I'm a proud Rotarian, I don't mind going to Rotary clubs and zones to ask for help. In the California area, Bay Area, this is a list of clubs in 3 districts, 5160, 5170, 5230, that have all over the years since 1989 donated to RotaCare clinics. They don't do it every year, but some of them do it continually. The clinic in El Paso was started 8 years ago at this point, by the El Paso Rotary Club. There are 6 in El Paso.
Huh?
But it's the bigger club that is handling it, and they take care of all the expenses. So they raise about $30,000 a year.
Just want to say, please mute all your phones.
Again, watching Rotary clubs get involved, and if you need you get interested or another club in your area gets interested, from a protocol standpoint, we would just be another nonprofit going to clubs in the area. And clubs will get involved when you think about what this is. The other one is it's very easy to get government elected officials and appointed officials involved. We have a county commissioner, and that, I guess, it's different than what it was in California. But I assume in the Dallas area, the county commissioner concept is the same. There's 4 commissioners and a judge. Miss Clay Flores met me at the church that we're going to be working in, and just recently, her assistant.
Please mute your mics. Mute your mics. They're interfering with the speaker. Please mute your mics.
Thank you. Miss Flores' assistant, Patty Hernandez, called me the other day and said that we'd like to get a budget from you because the county is coming up with their countywide budget and they want to include us in there. So we're going to get county money. Council member in District 2, Jalen McKee Rodriguez. That's a very poor area too. That's where our church is. One of his associates, Jolene Garcia, said that we will definitely help you with my financials. San Antonio and Bear County Medical Director, Dr. Wu, is on my board also, and she's willing to help with us, and she's willing to point out where we need some help and whatever else. And then as an example, and I'm sure I told you the story the last time, I talked to her at this point, year and a half ago, and we were talking at the clinics, and she was encouraging me, and I said, look, in my own obnoxious way, what I usually do is I decide somebody should be on my board, and congratulations, you're on my board. And she started laughing and said, I'd really like to be able to do that, but if you can tell me how I don't have to spend 95% of my time on COVID, I'd be glad to do it. Again, she was public health, and San Antonio was getting hammered by COVID. Anyway, she called me about 2 or 3 months ago. We were talking, and she said, oh, by the way, I would like to take you up on your offer of being on the board. So she was being genuine about it, so she's on that board now. And Cia Elmore is Dr. Wu's assistant, so when Dr. Wu isn't available, I talk to Cia. So the point of this is the government is out there willing to help. Now, one of the things that you say, well, why hasn't he started all this? For quite a while, COVID was getting in the way. It's still kind of getting in the way. When I talk to doctors like Dr. Wu, it's like, we're more than happy to help, but COVID has to be the priority. Which is always the question of, well, we're trying to start a clinic, how can we not be involved with COVID? But it's kept separate. There is one example in a second. But anyway, we were accepted by the San Antonio Area Foundation, which to me is an honor, and it shows credibility to anybody that I go out to trying to raise money. It is a fund, it's a foundation that handles, I think, a couple of 100 different funds. We are now a fund that they manage for us, and they basically take care of how to manage the money, how to invest the money, because again, they've been doing it for so long, so they got it all set. They serve as an umbrella for a 501c3 for small nonprofits. The benefit of this too is they know what they're doing with Texas and Oklahoma, and if, as other clinics sign up, they would become part of our fund if they want to. Their money would be kept separate, but the San Antonio Area Foundation would take care of all our taxes and all the 501c3 requirements, which in and of itself is another blessing. Otherwise, you'd have to get a CPA or somebody on the board. It's always hard to do that. Like I mentioned, they invest funds deposited by nonprofit members, lists of nonprofits as funds accepting donations. They've got several hundred funds available, and if somebody goes to their website, it's like Google. They can say, I want to donate to some sort of medical facility. Our name would show up as a free medical clinic. So there's the chance that people that we would have no visibility to would see us and donate to us. Which, again, since we're all Rotarians, you've all gone out doing fundraising. The best fundraising you can get is when somebody calls up and says, hey, I got money for you. It's like, oh, okay, send it over. Here, I don't even have to make the phone call. Management advisory. I'm on their management board, but they brought in some other people. If you've heard of WellMed, which is part of United Healthcare, somebody from their group is on my board. And there's a chance that somebody from HEB, the H.E. Butts Foundation, which is started by the HEB grocery chain, is on the board also. So again, that's a visibility that we've never got. And like I said before, they'll work with Rotocare clinics all over Texas and Oklahoma. They're not just interested in San Antonio, which it's just wonderful. I'm just so pleased with it. So it was worth delaying it. Part of their delay to sign us up is that they have 2 special funds set up for Uvalde, where they're raising money for Uvalde. And they said that the number of people worldwide that were donating just kept them so busy, which, both good and bad. The bad news is we got Uvalde, we need the help. The good news is the help is out there. San Antonio locations. The first one is going to be the Ephesus Seventh-day Adventist Church, which is the church I'm talking about. It's in East San Antonio. We keep saying San Jose. And then the second one is the College of Healthcare Professions. That's in South San Antonio. What the college does is they train people on using medical equipment so that a clinic is ready built. Their students have to put in, I think it's something like 180 hours before they graduate, using the equipment and blood tests and whatever else. So we are a built-in, facility for them to use. The Empower House, that one's back and forth. We're not sure about that. I think the first 2 are going to keep us busy for a while. As an example of how a clinic could work, they're very interested to get started. They've been very patient with me, but every now and then somebody calls me up and kind of prods. Hey, we know it's hard, but we're waiting, want to do it. They have a COVID clinic right now where people come in once a month and they get tested and they get vaccinated for COVID. My suggestion to them, and apparently they started to run with this, is as COVID abates and it's not that an important issue, keep the clinic going and just offer free vaccines for children as they get ready to go to school. Because again, that's another cost that some of the people living in these areas can't afford, and since we can get it for them. And what I would do is we would put that under the banner of Rotocare, so that when we go out raising money that comes in could also go to the vaccines. It would be all part of the same show. The idea of medical clinic, it says we'll operate medical clinic 2 days a month. That's the place to start. We may expand it. Again, depending on the need, depending upon the physicians. Where I say 3 physicians with a 4th possible, they're waiting to help out. And as a physician, we're doing this pro bono. In other words, they're all giving out their time for free. There's one of my cardiologists, as a matter of fact, young lady in her mid-30s. When I told her about this, she's like this glow on her face. She says, oh my God, I did that in medical school. I want to be involved. I can't come every weekend, but I'd be available. So the doctors want to jump in and help. Because when you think about doctors, some people say, oh, they're greedy, they need money, da, da, da. In most cases, someone became a doctor so that they could help people. And this is like the ultimate, where they're not worried about the money, they're worried about the patient and try to help the patient as much as they could. The idea has been approved by the state conference leadership of the Texas Seventh-day Adventist churches. Conveniently, they're located in Dallas. And again, if somebody in Dallas or North Texas area wants to get involved, they would probably be able to help us out. They also have foundations, so there may be money available from them to start clinics all over. And I mentioned this, room available to have health seminars. It's a church, so they have a lot of rooms available, and we would bring in people to do the various education. Okay, the volunteer opportunities. And again, I'm aiming at, if you guys are interested in starting one of these or somehow being involved, if not, that's okay. The point of the information is for you to go back and say, hey, that's great, let's do it, or, that's all right, but we're not interested. Or again, the other one is offering money through Rotary. You always get hit up for money. Anyway, what a club could do is appoint a standing Rotocare advisory committee. If you're interested in getting involved, you have two or three people that in your club that talk about Rotocare, that talk to us, that get involved. Participate on a Rotocare board state level to prepare for one locally. In other words, a local area, Dallas, Houston, or wherever it is, they know that in the next 3 months, 6 months, or a year, they're going to want to start a clinic. They would have a seat on our statewide board, if for no other thing than to sit, listen, and learn, and to get to know us, to get the people that are going to get to know the people on the board. Another one is participate in Rotary district, zone, or international meetings. Again, I got ill, so I couldn't go to the international meeting, even though I saw Linda and a couple of her friends the week before Houston, and I thought for sure we were going to meet up there, but I couldn't go, but we were going to be there. I've been at the zone. I was in the zone last year in Houston. where I met all the people in our two zones in Midwest and Rotary District conferences. That happens sometimes. Now, the good news, offering kind support, professional services, supplies, equipment, whatever else you could offer. This group, Medical Bridges, I met them in Houston at the zone meeting. They are not Rotarians, or the way I tell them, you're not Rotarians yet. I'm still working on them. Their mission in life has been to donate free medical equipment worldwide. And they decided that they're going to do a little bit of expansion in the US. That little bit of expansion is Texas. They were just going to go out to some rural communities in Texas. When I said I was in San Antonio and we were trying to start this, they decided that San Antonio was going to be one of their first places. Now, this would also include Dallas. I understand that when you start building a clinic, you could save $5,000 to $10,000 a year. The funds that you wouldn't have to raise on medical equipment, like the masks and stethoscopes and whatever else, things like that, blood test equipment if you do it there. So that would save us a lot. And again, not Rotarians, but it's networking through Rotary. And that's it. Questions, please. No questions.
Can it be done in other states besides like Florida or New York or any of those states?
Yeah, it can. I think you and I may have spoken the last time you were in Florida.
Yeah.
Yeah, it definitely can be. There was one in Jacksonville, but when the board kind of broke up, Jacksonville fell off the map. But I would go back to them and ask if they wanted to start it. If you had something you wanted to do in Florida, we could work it from there. So yeah.
Okay.
And if you're, I don't know how close you are to Jacksonville. If you're nearby, they could probably help you with it because they were doing some of it. They've got a more complex facility. We're not talking about the social determinants of health. That's their main facility, and they wanted to start a clinic like Rotocare. But they were working with us for a while. I'm not sure why they left them out at this point. But they were
Can you quit screen sharing? All we see is a black screen.
Yeah, I just finished my slides.
Yeah, but now we just see a blank screen, so if you can finish.
Oh, there you go. Unshare. If I can unshow stop share. I'm sorry.
Okay. Now,
So anyway, so back to questions. The Florida thing, if again, part of the dream a few years down the road, I don't know what's going to happen to the group that's the splinter group left in California. I'm not sure how long they can be around because they're not doing much recruiting. That was part of what I was doing when I was there. So when I left, they lost the guy that was doing the recruiting. So I don't know how long they're going to be around. But again, we're able to go anywhere we want to in the country. And I see this as, if you've been around Rotary long enough, you've heard of Shelter Box. We're similar to Shelter Box, where we're outside of Rotary, but through Rotary, they've gone worldwide. They have a different type of product, shall we call it, in need. However, I guess it was Hurricane Katrina, they sent something like 10,000 of their shelter boxes, within the US. So right now, we're kind of limited to some of the states in this country. We're still trying to get our feet wet. Part of what we have to look at is, if we start to grow, there will be a need for people to go out, but we would have to hire field people. So we're not quite ready for that yet. There's a chance of helping people get started. Dallas is not that far from me. There's other people that we can send to Dallas. Mark and Belinda Gist, who are in your club, they're not here. I must have scared them off. They were both they were in an e-club I was trying to form before they joined this club. And the main thrust there was to look at health issues worldwide. They and a couple other people in this country were going to look at where Rotacares could be started. So I know Belinda's pretty interested in it. So again, there's somebody in the club. Am I overselling to you guys?
hell no. We appreciate your coming in, letting us know
Thank
what's
you.
going on. Like I said, Sonny Sharma has a medical supply equipment company in Houston, and he's on your board. And so we're getting more and more people in, and I'll discuss, and maybe our club can make a small contribution. I know every dollar counts, so we'll see what we can come up with.
It would be a good place to start. One of my goals somewhere down the road is to apply for, I never remember it,
Are you applying for a
Project.
grant?
projects of scale.
Are you going to apply for a district grant?
I don't know yet. Again, we are kind of separated from Rotary. However, from what I was told by, I forget people's names, by the director last year, by Pat Merriweather, who's the director now for areas, to apply for a project of scale grant,
Okay,
which in Rotary terms is every year there's a $2 million grant. And somewhere down the road, in about 2 years, 3 years, if we grow the way I envision it, we show a track record, we go, now to get to the next level, we need the X dollars.
okay.
That's
For
what-
our district designated funds, like we work with the state of Texas on our tuberculosis project in Mexico. And so we just apply for a district grant, anywhere from $400 to $800.
Uh-huh.
Whatever. So you might check with your district. We have to submit them by September 1st up here. So I don't know what your deadline is down there. And I know like the Brownsville Club is going to put in a grant to help the same project, even though there's no Rotarians involved other in Mexico. But it is a tuberculosis project. It falls under the health. So anyway,
But as far as equipment, in Texas, there is a setup for if a state agency or schools or government agency surpluses stuff out for a couple of weeks, it is listed on this website. And if you've got a 501c3 and a need, it's free. And we've got some stuff there. Then it goes on the auction. We bought a lot of stuff at literally pennies on the dollar. That we bought an $85,000 test machine for $350.
Wow.
Then we had to find somebody that could use it.
and we
we finally
did.
did with the government clinic in
Mexico.
uh,
In Mexico. I think in Reynosa. So
But-
anyway.
we found when I started working with this clinic, I said, oh, I gotta raise money because I need stuff. Every one of you has something that I could have used that you don't want anymore. The problem is, I don't know you have it and you don't know I need it.
Right,
Well, that's where we gotta communicate.
right.
But the stuff is out there.
I would imagine the organizations I mentioned, especially the Texas Charitable Association, that they would have a list of that, a source of that, or I would suggest to them to start doing that. One of the areas we're gonna look in here, because the club in the district does it, is apparently by Texas state law. You can go to an organization, a church or whoever, that does bingo, and they have to donate a certain amount of their take, shall we call it? I hate to say that about a church, it's
Their
take.
income.
Their income, their gift from the community has to be regifted to nonprofits, to 501c3s. And I'm gonna look to be doing that in San Antonio. We have one club in the district already that is offering us money for that program. But it's the bingo, and from what my friend was saying in this district, that none of the clubs do it, nobody looks at it as if it didn't exist. So as long as it's a well-kept secret until I apply, we're good. But yeah, no, the money's out there. I'm also gonna start working a little bit more with Sonny. I'm gonna be calling Sonny to get some ideas, because I think he would definitely be able to help with sources. He also started a clinic, I think somewhere in Central America.
In Haiti, I believe.
Haiti. Oh, was it Haiti?
I
Wow.
think it's Haiti. He works at several different places. I know he's done a lot with Haiti and training technicians on how to use the equipment, because they kept coming back and saying, hey, we need such and such. Well, we just sent you something a year ago. Well, it doesn't work anymore. Well, they don't know how to fix it. So he had a training and trained like 15 technicians. So I do want you to know, we do have several people on here that have never been on here before. Mary Faye and Kay. Kay had another meeting, but Mary Faye is still on. And they're with the Cedar Hill. We also have Ashley Beverly. She's on her phone, and I've been talking to her for months. And hopefully she'll join us one day. And also Deborah is our AG, Assistant Governor. We have Anita. Anita, are you also through Rotary International that I've been talking to you? Can you unmute yourself, Anita? If you're still on?
You may be gone.
I don't
She's
see
on
her.
phone. Well, she was on her phone a few minutes ago.
Okay.
but I've been talking to her for a while. And so we hopefully, yeah, I think she has to leave. So we do appreciate all of you being on. Ashley, give me a call. And there's Shirley Weddle from the Suicide Prevention and Brain Health Rotary Club. And I think she's heard Charlie before.
As far as equipment, there is a Rotary group in Tulsa, and they accumulate medical equipment, all kinds of stuff. And then they have people who can refurbish it. And then as soon as they get it fixed up, they want to send it to somebody. And it's all free. They may not have what you want, but you can tell them what you're looking for, and if they get it, they'll get in touch with you.
I'm sorry. The thing with Oklahoma, the good news is when I was at PETS this past year, having a table talking about RotaCare, President-elects came up, and there were several presidents from Oklahoma that said they'd be interested.
Okay.
So that would be good to open up there. Yeah.
Well, that could be in Oklahoma City, near Oklahoma City, Norman. Tulsa is in another district, so they don't usually come to PETS, but there is Norman where, several people that they come in that district comes into our PETS. So we can get more districts involved.
Okay. I always thought that once Oklahoma started to move in, that it was Oklahoma and Texas that would start that. I guess not.
No, in fact, it's only a few years ago, maybe 5 or 6 years ago, that they allowed just that one area of Oklahoma to come to PETS. So
the problem at PET is we don't have enough classrooms to do the training for any more people than the 10 districts that we've got now.
yeah, we have close to 800 people that come to our PETS.
About 500 president-elects.
Yeah, there's president-elects, president nominees, and all that. They come, and so anyway, there's usually around 800 people that come to PETS. So anyway, I don't have anything else. Thank you, Shirley, for coming in.
Thank you.
Missed the main thing, but
I'm sorry, I didn't get a notice on that. I thought your meeting was tonight, so I went to another email and found your link.
oh well, I talked to you yesterday. Remember, we're the day after you. Let's see, what else? I think we've covered everything, but let me know if anybody locally can meet with us next Wednesday night, Tuesday, tomorrow, or Thursday, next Wednesday. Tomorrow night, we're meeting at 11 o'clock at American Airlines at DFW to greet our international exchange student. So anybody wants to come, let me know. We'll give you the American Airlines deal, all that. So Deborah, you raised your hand. You want to say something?
I did, and I had a question for Charles to find out if he's speaking to any other clubs about RotaCare. But I see he's no longer on the call.
Oh, Charlie, did you leave?
He left.
Oh, I will find out. He's out of San Antonio.
We've
And
been
so,
in it.
we've gone to his club. They meet at 7 o'clock in the morning at a brewery or a winery, whatever it is. But we've been there. And I will get with him. But if it's on Zoom, I'm sure he'll do it. But like I said, he is out of San Antonio.
Jared was smiling about meeting at the brewery.
Yeah, they meet, their whole club meets at a brewery. Let's see, anybody else have anything to say? Jack, anybody? You can all unmute if you'd like.
Okay, then let's do the four-way test.
Glad to see Maria and Wendy on here tonight. We've got a good attendance, so thank
Did
you
you
all
say-
for coming.
Did you say 11 o'clock tomorrow night?
Uh-huh. Our Rotary Exchange student from Switzerland is coming in. So,
There's 2 terminals in Little
we
Oh,
will-
get me an email address for them, and I'll send them my learning programs so they'll help them in school.
Who? To the exchange student?
Yeah.
Oh, okay. Well, use it for Jericho's. You've got Jericho's address.
Okay. Does she have mine?
Anybody in the club can access Club Runner, and you can access anybody in our club. If necessary, I will go ahead and get a one page of all our contact information and just make a little directory and send it out to you, and y'all can each print it. I'm not gonna
You
print a
haven't
whole
talked
bunch.
about our visitor right next to
Oh,
yours.
my visitor right next to me is a little kitty that was about this big when he got stuck underneath my car. And there he is now he's now Mr. Kitty Monster. Because he loves to bite my toes around 2 or 3 o'clock in the morning. And he's always wanting to be the center of attention. So at least maybe y'all put him to sleep tonight.
Well, then if you may have putting him to sleep at our meeting, so.
Yeah, he likes to go to meetings. At least he's not on top of my laptop. So
He's attended more Rotary meetings than some people.
that's true. Oh, okay. Does anybody have anything else? Yes, Shirley.
Yeah, can I ask, one of the things that John mentioned to us at our meeting last night was the grant deadline. Did you guys already talk about that?
Yes, we're gonna be submitting it due by September 1st.
Okay.
And then this Saturday, for those that are local, if they want to go, it's the round table, and that's where our district round table is. So, anyway,
Do you already have a Christmas project that you're working on, a service project? I was curious.
we work with the Salvation Army, and also I work with Child Protective Services, and they're going to give me a list of names of challenged kids. We're going to try to get 20 to 25 kids. Have Rotarians make a $25 purchase. They'll give us a list of their wish list. And so we're trying to keep it to $25 that everybody's treated equally. And then I have a place in Grand Prairie where we'll have it. And I have a Rotarian lined up to be a Santa Claus. So, and we do the food and, we do the, San Antonio, the valley, we work tuberculosis, and David and I go down to the valley the day after Christmas and spend about 3 or 4 days down there and work with 2 other Rotary clubs down there. And also while I was at International, I met a president-elect from the Ciudad Juarez North Day Club, and he wants to also come down when they purchase food, and he said his club would contribute also, but he wants to go down to Matamoros when they purchase, so he'll be working with us too.
We would be interested in, I know last time I participated in the Christmas thing, but I think for our club, we'd be interested in knowing what you have going, maybe we can combine, or some of our folks might participate also.
Oh, that'd be great, yeah. Because last year I had my sorority, but I'd rather keep it within Rotary, so we'll come after you. Okay, it's almost time to wind down, I think, and David wants to say something.
For the president-elect, or I guess new president, never in the history of Rotary has anyone complained when the meeting ended early.
So we're ending about
Remember that
9 minutes early. Well, okay, Howard, would you like to lead us?
Sure. The full-way test of the things we think, say, and do. First, is it the truth? Second, is it fair to all concerned? Third, will build goodwill and better friendships. And fourth, will be beneficial to all concerned. And others will be fun. Hopefully I'll see some of you next week at the dinner.
At wherever we meet.
Yeah.
Anybody will have suggestions, and we'll see some of y'all tomorrow night. And have a good week. And thank you, Howard. And I know you're going to be thrilled to death to see us.
Yeah, I am. That's right.
He's lonely.
Yeah.
He's only seen David and me yet coming out there in January.
They come every year, and Vicky and I go to meet them.
Yeah, so anyway, y'all have a good time.
Bye, everyone.